Welcome, and thank you for taking the time out of your busy schedule to learn about NurseMuse, what it can do for your students, you, and your program. So when the student logs into nursemuse.com, the first page that's going to pop up is the dashboard page. And I just want to show you how the students would start entering data for their patient. So the first thing they're going to do is click the Add button. One moment, please. And after clicking the Add button, it does take a moment to populate. So here's just an outline of what the students were going to be filling in for their patient once they have their patient assignment for the day. So what I've done is I have already created a patient for demonstration purposes with all of the information set up. So we have the hospital name, the initials of the patient, the room number. If the patient is a DNR, there's a radio button here that can be added. Here are vital signs that I've already entered. Our patient here has penicillin, but if you were going to enter another allergy, all you have to do is type it in and click the blue button, and you can see that it's saved here. So the whole premise behind NurseMuse is that the medical diagnosis has been linked to the nursing diagnoses, the nursing interventions, and the nursing rationale, so that we can help our students understand how all of these pieces fit together. So just for demonstration, our patient has asthma, and I've chosen the nursing diagnosis, ineffective airway clearance. Of course, you can add more than one nursing diagnosis. So let's look at hypertension. So I start typing in hypertension and I have to click this blue button, and you can see hypertension is listed here. So I'm going to go down to my nursing diagnosis. And up here, there's a search box, and I can search hypertension. So here are all of the nursing diagnoses associated with hypertension. So because my patient has hypertension and I've assessed my patient, I'm going to choose this nursing diagnosis for this patient. And then all of these boxes are actually interventions, specific interventions related to the medical diagnosis. So I, as a student, can just click down because I've assessed my patient and determine how I'm going to take care of this patient for this day. So as you can see up here, we have the nursing intervention and the rationale, and I have identified which interventions I'm doing, and of course the rationale. So for our care plans, we like our students to identify the nursing diagnosis related to as evidenced by. I have 4 boxes here so that students can free type their nursing diagnoses related to and evidenced by. If I forgot the pathophysiology of asthma, I can type it in here, and the students will be shown an overview of what asthma is. Of course, I can do this with any medical diagnosis that I'm working with. And then here is a notes section for the patients or the students. So throughout the day, I can add notes on my patients. And once I've completed this page, I just need to click update. And it shows that it's been successfully updated. So here under patients is the patient that we are working with. So if I want to go in at any time during the day and add more nursing diagnoses or medical diagnoses, I can always go back to patients. And then here, of course, we can always add notes. Just remember, anytime you add a note or add anything, to click the blue button so that it saves. And it's been successfully updated. So now I'm working with my patient for the day. So I'm going to go to my patient. One moment, please. And now I have to come back to the dashboard it is important that you click on the appropriate date of when your care plan was made so that you can find the patient you were working with. So here's the patient that we were working with. So I'm on the dashboard. Throughout the day, I can enter vital signs as needed. Again, anytime I enter vital signs, I'm going to click add and then save. And then here is all of my interventions that I chose after assessing my patient. So this is the intervention, the rationale. I can free type the patient outcome from that intervention. And once I have completed that, I can click is complete. And it's going to pop up here on the correct date that that intervention has been complete. So this keeps me on track. I just simply click on the nursing diagnosis and it lets me look at the intervention, the rationale. Again, I'm going to free type the outcome from the patient is complete and then hit OK. So the students are going to do this for all of the nursing diagnoses. And then at the end of the day, once I've completed all of my nursing interventions, I've documented. What I'm going to go do is go back to my patients. And here's the patient that we were working with. And I'm going to click on this top icon, the eyeball. So this is going to show you, this is the first page of the care plan where it has all of the information that we have entered in the beginning. And then I'm going to click nursing care plan. So this is time stamped and dated. All of the information. Of course, if our patients are on medications, the students will have to free type the medications, the actions, the uses, the side effects, contraindications. This is the pathophysiology for asthma that we looked up. Of course, throughout the day, we're going to have more than one set of vital signs, but they're going to show up here. Here are our nursing diagnoses. Like I said, there are 4 boxes so that the students can enter 4 nursing diagnoses related to as evidenced by. And then here are the specific interventions I as a student chose, the rationale, and then of course the outcome that I have documented. Next, there are some boxes where the students can free type any interventions that they've done for the vital signs. They can free type their head to toe assessment. And then we broke down the documentation into systems so that students can really work on documenting appropriately for each system. And then at the end of the day, if the instructor would like their students to write a SOAP note, there's an area here. So once all of this is complete and the student is finished for the day, he or she can click print this out and turn it in to their instructor. Now here on the left are some resources that the students will have at their fingertips while they're using this in clinical. So for example, the Glasgow coma scale. So it shows you, how you rate that. Food interactions, that's important, along with drug interactions that the students might need to refresh their memory on. Here are the vital sign ranges from neonate to older adult. Nursing doses calculations. I know students have problems with this. So this is a little cheat sheet to help them with their dosages and just some refreshers. So cardiac strips, what different strips look like, the interventions that the nursing students should do when they see strips like this. And of course, the faculty can use these questions. So we've put in questions based on systems where the students can answer, and then the answers aren't shown to them right away. If they would like to see the answer, they just click show the answer. So there are some awesome resources here on the left that I think is really important for the students to have at their fingertips in the clinical. And I think really putting together the medical diagnoses and the nursing diagnoses and the interventions and the why is really going to help them understand what they're doing and why they're doing so that they can provide safe, efficient, and effective patient care. So thank you so much for your time. I appreciate it and have a great day.